right, it looks like we have a quorum. It looks like the recording is going, so take it away, Michelle.
Great, thank you, Dr. Appreciate that. Welcome, everyone. My name is Michelle Glass. I'm one of the co-chairs with Amy of this work group, as most of you know. It's really great to see you all. We are going to get started with our June Community Engagement and Communications Committee meeting. So we're going to start with tech check, roll call, and agenda review per usual. So I will turn it over to our fabulous staff member, Isabel.
And today we unfortunately do not have interpretation available. Our interpreter was unavailable today, so unfortunately we do not have live Spanish interpretation. So we can disregard that. And I think with that, I'll pass it over to Mimi to do the roll call.
All right, good afternoon, everyone. Michelle Glass.
Present.
Thank you. Amy Fellows. I'm not seeing Amy yet, but I believe she's planning on being here at some point. Grace Hokog. Mickey Dirting.
I saw Mickey come off mute. I don't know if you were able to hear her.
I did not, but thank you. We will take, oh, there you are. I see, Mickey's here. Thank you.
We can't hear you, or I can't hear you.
Yeah, I see that. I do too. Mickey, we don't see you as being on mute, but can you say present or here again, just for a check?
Can you hear me now?
Oh, now we can. Super.
I'm here. Thank you.
Yay. Awesome. That is great. All right. Juan Pablo Garcia. Colin Stackhouse.
Present.
All right, Colin. Max Brown.
Here.
Hello. Jensina Hawkins.
Here.
Hello. Jay Brown. John Buzzard.
Here.
Hello. Craig Newton.
Here. Hello, everyone.
Hello. Yesenia Hernandez Solis.
Present.
Hello. And Jocelyn Ogden. I think I see their name. Thank you, everyone. All right, we'll keep going along. Back to Michelle, actually, to either go over the agenda and then introduce our communications consultant.
Thank you, Dr. McDonald. So this is our agenda for today. We're going to cover committee and board updates. We're actually going to move the order around, as the doctor just alluded to. So after this agenda review, we're going to pass it to our new communications consultant for a communications plan consultant update. Really excited to have Patty Wentz on board with us. And then we're going to do committee and board updates, the universal, our board style guide review and revision. So hopefully y'all have had a chance to think more about that style guide draft. We'll have a discussion about that. And then our work plan and timeline update. So checking in on what tasks are completed, what we're focused on next, and then what is coming in the future. Committee member updates, where you all share your updates on engagement work that y'all are doing. And then we'll end with meeting reflection and future topics and listening to any public comment. Any questions about the agenda? All right, hearing none, I am thrilled to hand it over to our fabulous strategic communications consultant, Patty Wentz. Thank you, Patty, for working with us, and I'll let you introduce yourself. I know that you all have met Patty before. She visited a work group meeting earlier this year, but She's now here in her official capacity as our hired consultant, which is really exciting. So go ahead, Patty.
Hi, everyone. I too am very excited to be with you today. I am not going to take up very much of your time today because the ink is just barely dry on my contract. I've been with you for 24 hours, but I do want to say that yeah, I'm really looking forward to working on this project. I love working on health policy and talking to people about some of the most complicated things any of us ever have to talk about, the intersection of government and health. Over the next several weeks, I'll be working on putting together a draft communications plan for this phase of the work that you are doing. And of course, all of this will be built on the great work that this committee has already done. I was looking over the notes from the last committee hearing, and I know there's a strong desire to get some talking points together really quickly and some Q&A. So now that I'm here, I will be digging in on that. And also we'll be, I think as part of the work plan, we'll be meeting with many of you individually as well, not all of you, probably all of you.
Thanks so much, Patty. And if y'all remember way back to November, approximately 6 years ago, we generated a list. You all generated a priority list of basic materials that we really needed from a communication standpoint. We have passed that on to Patty. So they have a dedicated expert consultant that's going to be working on some of those drafts, and then you all will have a chance to give feedback on those drafts. So want to honor the feedback you all gave in November. Know that that work was not lost. It just went on pause for a little bit. And really excited to get that started. So does anyone have any questions or want to join me in welcoming Patty?
No questions. Welcome.
Thank you. And I'm very sad to say that I have to jump off at 2 o'clock today, so I don't get to stay for the full meeting, but really happy to be here.
Thanks so much, Patty. It will be recorded for posterity, so we'll get you that link if you need it. Any other questions for Patty? All right. Thank you, Colin, for joining me in welcoming Patty. You all will be hearing more from her as we move forward. And at this point, I'm going to pass things back over to Executive Director McDonald for an update on our committee and board. Thanks.
For a little back in here. So first off, I'd like to talk just a little bit about kind of what this part of the meeting I am hoping to do is give the committee a sense of kind of what's been going on at the board meetings and what's happening with all of the other committees, because of course you all are interdependent on one another. So the last board meeting it was on June 12th. Just a couple of high points that went on. The board is still looking at the mission statement. It's continuing to go under revision, and I believe both of your chairs, Michelle and Amy, talked about bringing that information and getting feedback here at this committee, so it will be coming this way as well. The Plan, Design, and Expenditure Committee created an eligibility straw proposal, which went before the board and was approved with some requests for further refinements. So that's happening. Operations had created a trust fund proposal, straw proposal that also went before the board and was approved. And then there was a discussion around kind of what does it mean? What would regional entities look like in the state? So sort of the beginnings of that discussion. Next up, we have our, as I mentioned, Plan, Design, and Expenditure. They have a meeting coming up in a week. So they have, as you probably know, kind of a big scope of work that they're doing. One of the largest is sort of refining a provider payment system. So in fact, there's even been a subcommittee that's been developed. We had these amazing presentations at the last Plan, Design, and Expenditure meeting about primary care centered homes, about behavioral health homes, about accountable care organizations. And so and then additional information has gone to the subcommittee members, so they will be able to come back and kind of review all of that committee, hopefully to start to refine and really build on what that's going to look like. Our Milliman consultant group, unfortunately, the ink is not dry because their contract has not yet been signed. However, plan design is still going forward. Plan design will also will be working on refining the eligibility straw proposal too, just kind of fine tuning and making sure that all of the any of the federal regulations, that those will be incorporated into it appropriately, and same with the Oregon regulations. Finance and Revenue is now working very, very closely with Echo Northwest, our consultant group, on revenue strategies. So this is really the heart of what Finance and Revenue Committee is doing, is working on looking at all different types of strategies to have enhanced revenue, to be able to provide healthcare for everyone in Oregon to the level that people are that has been proposed. And so now looking at different ways to bring that revenue in. So that if anyone has any time ever and is interested, and you can catch the next couple of finance and revenue meetings, I think they're going to be very, very interesting. And I would say the other caveat about that is that the Finance and Revenue Committee has worked very hard on developing sort of their values around what is important when you think about finance and how revenue is created. So just that that worksheet that they created is available too on the website. Operations, also another group that's going along like gangbusters, have created again the trust fund straw proposal, and so now there's more work happening with DOJ and also Division of Financial Regulations to refine that work, and now just jumping into startup costs. Also, as I mentioned, Milliman, the consultant group, we had hoped would be onboarded now, but should be fingers crossed coming on board in July. So that was a lot and pretty fast. I'm a fast talker, sorry, but if anyone has any questions. Or wants to add anything, okay, great. I will sign off, and I think the next up we have is the style guide.
Thank you so much, Executive Director McDonald. And just a quick framing note around all those detailed updates. I really appreciate you bringing the other committee updates to this meeting. That's something that's been missing. And as you mentioned, our committee all the committees are very interconnected, and our work is iterative. So it goes back and forth from one committee to the other. So I just want to put a this is the detailed dive of where we're at right now. We've been referring, since we started meeting last fall, to the other committees that are creating a draft plan. And that draft plan is what we're going to base our community engagement around. And so this is, just to connect it back to how we've been talking about these updates in the past, this is where that plan development work lives in each of these committees, holding different pieces of it. And this is the current status. And I do just want to also share back kind of big picture that we are still, we've updated the timeline to sometime late fall, maybe October, November-ish, to have some of these draft plans ready for community engagement to start with Diana Bianco from Artemis Consulting. So I hope that helps connect this deep dive of what the other committees are doing to our work plan in the way that we've been talking about it previously. And certainly, yes, if you have any questions that occur later, you can email them in, but this will be kind of part of every meeting now, is getting a much better sense of where that big project of developing other plans actually stands. So I hope that's helpful. Great. And I think our fabulous staff member, Kim, is here. I think I saw you join, Kim. Thank you so much, Kim, for all your work on this. I do want to say before I hand things over to Kim that tomorrow is their last day with the Universal Health Plan Governance Board, and it makes me sad. They're returning to their other duties. They were a temporary assignment to support us as we went through a staff transition, but I just have so much gratitude, Kim, for the work you do and the way that you do it. I'm so grateful I got the chance to work with you. Thanks for everything that you did to support this work and move this project forward. And so thanks for being with us today on your second to last day. I'll pass it to you.
Thanks, Michelle. I am really grateful for this particular committee. your work is near and dear to my heart. So I'm just thrilled to get to work with you, sad to have to say goodbye, and thankful that you all are committed and excited about creating a style guide for this project. Really appreciate everyone who's weighed in already. So today for this portion of our meeting, I'm hoping to revisit our style guide, which I'm going to hand to a different staff member to guide going forward. But of course, it ultimately belongs to this committee. And so I hope that all of you feel comfortable taking a big part in this. So the style guide is available in both an English and Spanish version. The Spanish version has the comments translated to that your fellow committee members have submitted. So thank you to everyone who was able to write in comments. Today, the hope is for two things to happen. One, for us to go through and solicit live comments that I can write into the latest draft to capture people's thoughts in case you weren't able to submit thoughts ahead of time. And then two, as I transition out of this work tomorrow, for us to, again, capture folks' live thoughts. Nothing is wrong to say for this, but live thoughts in the document, which I'll type in so that we can have it captured in both the notes and on the document itself as it moves forward into your all's capable hands and the new staff members' hands. Does anyone have any questions before we start? Oh, and I can't see the queue very well, so maybe Michelle or Mimi, if you would mind, thank you, monitoring the queue for hands up, please. Okay, if there are no raised hands, Isabel, could I please be able to share my screen?
Yes.
Thank you. Okay, so in a moment, what should come up is the table of contents for the style guide. And just to, thank you. Thanks for that confirmation. So just to remind folks, the style guide has four main sections. The first is a brief background section that explains why the style guide exists and what it draws from and the thinking behind it. The second is a standalone section that's going to discuss institutional betrayal and medical trauma. Your co-chair, Michelle Glass, recommended this section here. The third section is a section about guidance for terminology that the Universal Health Plan project can use in its documents and communications, public facing. The fourth section is guidance for Universal Health Plan related messaging. And so that will be created in conjunction with our very capable consultants, Patty Wentz. So hi, Patty, welcome, and Diana Bianco. And then last, the fifth section is just an appendix that links to various resources that already exist in the state of Oregon around terminology and use. Okay, so again, reminding us of the goals. I'm going to skip through the background section, but thank you to the folks who were able to submit edits and comments on the background section. The two goals for today are to get folks to sign up to help develop sections together, and then to offer live commentary. So the first section to revisit together as a group is context on institutional betrayal and medical trauma. So we had a couple of comments in this section. So the first, and I'll read them out loud in case folks aren't able to see them easily, but Craig Newton emailed a comment about the section, and the comment says, I was wondering if we could get some clarification as to what institutional betrayal is. I did look up the definition, but feel even more confused. And is it possible that this section is not even supposed to be a part of the document and was mistakenly left in? My point is, I am confused to what this has to do with communicating the proposed universal health plan. Is it to demonstrate that we acknowledge past institutional failures? And then the second comment in this section is from Colin Stackhouse, who says, I'm not sure how we dive into this, but this first article I found with a web search from NIH seems interesting. And then the third comment is from Jensina Hawkins, who says, I assume this is where we give the why as to the importance of a style guide, I'm presuming. Okay, so pause there. Michelle, not to put you on the spot, but would you like to offer some recommendations as to why this section is important and perhaps some of the pieces we might consider adding to it?
Yeah, thank you, Kim. And thanks everyone for engaging. And I totally, I think I really welcome this question of, does this belong here? What does this mean? And also acknowledge that a lot of definitions around this are super wonky and inaccessible, which is highly ironic in my mind. To me, when Kim brought the idea of a style guide, this came to mind to me immediately. So I do health equity work. I work with frontline communities who have been harmed by many systems and institutions in the United States, like communities of color, LGBTQIA2S+ communities, disability communities. And I also did a lot of frontline work during COVID-19. And I will say, anytime the government has a healthcare related offering that is designed to improve health outcomes for communities, there is a living legacy. I would say it's not even past institutional betrayal and trauma. It is current today, institutional betrayal and trauma from many, many people and for many communities. A brief example is in Southern Oregon, we were working with communities to make sure that everyone who wanted access to COVID-19 information and resources during the pandemic had access. And we thought that we would be providing information and resources. Like, here it is. Maybe we'll translate it. What we actually ended up doing was sitting and having a lot of deep conversations with Black women about women in their family who were involuntarily sterilized without their knowledge or consent by the public health system in the United States. That wasn't something in the past. That was living for them that day. And they were like, how do I know I can trust this, what the government is providing me right now that they say is going to save my life? This is the experience in my family, in my community. I don't have that trust. So there was a lot of listening and slowing down, acknowledging the very real presence of institutional betrayal and medical trauma. And that is one tiny example. This happens every day in my community in Southern Oregon. People are misgendered by their providers. There's so many things that happen. So to me, if we're going to say, okay, Oregonians, we're offering healthcare. Here's our proposal for this plan that's going to cover everyone. We're all going to pay into it. It's going to be great. We promise. The first thing we have to do is understand and acknowledge that this is going to be a barrier. And it's not just, and it's going to be, we have really diverse people who work in healthcare, really diverse business owners. Like, it's every time we go to engage about this plan, this is going to be in the room. And if we don't understand and know how to have some plain language, accessible language for how to talk about that and acknowledge it when it's appropriate, we are not going to be able to have a conversation and get feedback on this plan in the way that we want to. So I hope that helps. I don't know if anyone has any further clarification, questions, or things they want to add to the conversation. I see your hand, Mickey. Go ahead.
Thank you, Chair. I just wanted to also say that I think it's really great to bring it to the front to let people know about it, for those of us that are new to the terms, to increase awareness about it. So it's bringing it front and center so that we could address it together.
Yeah, thank you. That's a great point. And I am happy to, since I know how it works, right? You have an idea, you get voluntold. I will be happy to work on a plain language definition of these terms, and I would welcome anyone who wants to work with me on this section. Mickey and Colin, I see Mickey and then Colin.
Sorry, I just forgot to lower my hand. Thank you.
Go ahead, Colin.
Yeah, I am interested, Michelle, in helping with the group on some of this plain language work. One sort of question or we're at a point now where we can do whatever we want, right? This section could be 5 pages, or it could be one very open-ended paragraph, or it could be much longer, you know? So I don't think there's utility in that, but I just wanted to mention that we need to decide what we want to present. I think like maybe a half page is easy to read. I think we could winnow it down to that, but I'm just making that up. So I'm curious what other people think.
Thanks, Colin. I look forward to working on this with you. And also want to note, like, I think we have so much diverse experience and knowledge and lived experience here in this committee. So excited that that is, you know, is and has been part of this drafting process. And we get to leverage that along with some strategic framing. So we may do a first draft and then kick it over to Patty to make sure that, you know, because we're trying to do plain language, multilingual communication, and then making sure that we are putting it in line with all of our other strategic messaging. So there's going to be many layers to this process. And yes, you're right, Colin. We get to decide what this looks like and how much is helpful and how much is too much. So yeah, I don't have a preconceived idea of what that looks like, and I look forward to figuring out together.
Thanks, everybody. So another open call. Would anybody else like to work with Michelle and Colin in developing the section, or are there other thoughts that people would like to record? And you can always submit comments after this meeting to any of the staff members if you aren't comfortable or aren't able, like me, I'm a slow thinker, to provide ideas straight away. I see a couple more hands up. So Michelle or Mimi, could you call in order, please?
Sure. Yes. Thank you. Jensina, and then John is in stack.
Hi, thank you. I would love to be a part of this, and my reason actually why, so I'm married to the president of the NAACP chapter here in Eugene, Springfield, and so I receive a lot of context from communities of color, but also as an Asian American, I think that there is a lot of room for understanding as far as that institutional betrayal, not necessarily even a healthcare institution, but governmental part of it. That's one thing that's very prolific, particularly in the Asian community. Many of the immigrants come from countries where the institutions have collapsed entirely, or maybe if we look at some of the Middle Eastern immigrants or things like that. So I think that this is a good section to have. I would love to participate in helping craft it, and we need to maintain awareness of all the different communities that have their own interpretation and reflection of institutional betrayal.
Yes, thank you, Jensina. I know that that is something that we have heard in Southern Oregon from Indigenous communities as well, for sure. So expanding to, some people won't see this as, some people will see this as healthcare. Some people might see this as government first and foremost, right? So I think you're right. We need to expand this definition. Go ahead, John.
All I wanted to say is I'd be happy to support the collaboration on the development of the section.
Perfect. Thank you, John. So I have Colin, Jensina, and John, and then I see your hand. Go ahead, Craig.
Thank you. I just want to give further context to the reason I asked that question. I apologize, everyone. I missed last month's meeting. I had jury duty. And so anyway, I was kind of in the dark as this section. There was nothing underneath it. Anyway, the reason I flagged it, asked that question was, I'm not disagreeing with anything anyone said. It's smart because this is going to come up. You're absolutely right. The reason I just asked that question, I felt like we were looking backwards instead of forwards. And what I mean is, I'll use myself as an example. Let's say I enter a room of 100 people and I'm trying to sell the universal healthcare plan to Oregonians. And I was worried that we were going to spend half the meeting listening to people's complaints And instead of looking and trying to sell what we're offering, I'm not poo-pooing in anything. I hope you kind of understand what I'm saying. I'm not disagreeing with anybody. We have to do this. You're right. People are going to bring up the negatives. I was simply, I was worried about us ending up defending the past or justifying that, and then we never would get around to, here's what's the positive. Here's why we want to move forward. That was kind of the whole gist of my question. Thank you.
Yeah, well, I think that all questions are fair. And if you had that question, other people are going to have that question. So I'm really grateful you brought it forward, Craig. I think that one, and I know this is tricky we've had this conversation before, and I acknowledge that many of us outside of this committee are advocates or play the role of an advocate in some way at some point. We are not, as the Universal Health Plan Governance Board, our role is very neutral. Our role is to develop a plan and then to get feedback on that plan. So we don't actually have the task of selling anything. Our task is to convince people to engage with us and to share their feedback. And so I think it is really important. What I have learned over the past 2 decades of doing community engagement work is that if you can't acknowledge people's experience first, they're not going to engage with you. And so I think it's a real barrier to getting the broad, diverse feedback that we are tasked with the legislature with listening to and documenting if we can't acknowledge this. And so I think that I don't think that we have to defend anything that's happened in the past. Like if people share their experience, I think we need to have context for that. We need to be ready to listen. We need to understand how deep and profoundly present this is for people every time they hear about a government program. And not all of us have that lived experience. And so that's why it's here, is to prime us all to be ready to be good listeners in that way, and to frame our invitations in a way that lets people know that if that has been their experience, that we are ready to hear from them as well. So I hope that helps. And if you have further questions or comments, my cat is very involved in this conversation. I really welcome your continued questions, Craig, because I think that they help us to craft something that is going to resonate with people, and hopefully answer those questions that other people might look at this and have the same question. So this is part of diverse perspectives. I really appreciate you bringing that forward, and I hope if you have continued questions or concerns, that you might share them on a future draft or join this little work group. So anyone else have comments or want to be part of developing this section? All right, I will pass it back to you, Kim.
Thanks, Michelle. And Craig, I'm totally with you. When I first put this document together, I hadn't even thought about including this section, and Michelle was kind enough to suggest it. And so that's how it was put onto my awareness, even though certainly as someone who works in the equity space too, these concepts are on my radar. And so don't worry. I think, like Michelle said, if you had that question, I'm sure other people had that question too, because I certainly had an analogous version of it. Okay, we're doing amazing. Thank you everyone for engaging. So if there are no other volunteers or comments on the first section, I'm going to move us into the second section, which is the guidance on specific terminology to use in the Universal Health Plan documents. So I've offered a couple of suggestions of what we can include here. Folks are certainly welcome to offer suggestions and recommendations on other terms to include. I know this was just the thoughts from several people, but not all of us. So again, thank you for everyone's comments and input on this section so far. The first just small question that I had was how we might order the terms in this section. I suggested alphabetical. Jensina said, sure, sounds great. Does anyone else want to offer a recommendation on how we order them? I was trying to think, it's kind of difficult to say what is the order of importance. And so alphabetical seemed a little bit logical, but I'm open to other ideas.
I see your hand, Colin. Go ahead.
Yeah, I think alphabetical totally obviously makes a lot of sense. And also, like, just the first thing on the list currently is the phrase of who is the plan for? Is it for Oregonians versus people in Oregon? That's like number one on the list of things to say. So maybe that should be first. That's not a final solution, but just a different perspective.
Thanks, Colin. I do, yes, I could see the utility of alphabetical. And I like what the direction I think you're pointing to, Colin, which is, I don't know that every committee member or even every committee chair or board member is going to like read through the entire alphabetical list. So if it were grouped around like, this is how we refer to people, they're in different, like diverse groups of people. This is how we refer to, I don't know, if there was some kind of natural way to chunk it by topic in a way that specifically relates to our work and what piece of our work we're communicating about, that might be more user friendly as a reference document. And one of my hopes and goals is to make it something that's not going to sit in someone's digital shelf, but it's something that's going to be used really actively. So I think that's partly why I'm thinking that direction.
Awesome.
Are there other thoughts on this topic? John?
I guess that what you just expressed was, I think, something that was forming in my mind as I looked at it, which was some kind of clustering of terms around thematic elements, like you said, people or health conditions or like something like that. That clustering kind of makes sense to me. The most natural thing, obviously, is alphabetical, so it doesn't appear that you're kind of privileging certain things or ordering, like it seems neutral, but it may be more user-friendly to have that clustering so that you don't have to kind of you can sort of get all the information that you need about that cluster of information, whatever that is. And again, I'm not proposing one, and I haven't really spent enough time really thinking about that manner of ordering things, but I see the potential appeal and usability of that. Yeah.
Thanks, John. Anyone else? I'm not seeing any other hands, so I'll kick it back to you, Kim.
Thanks, Michelle, and thanks everyone for your input. It doesn't need to be solved today, so I think that this committee has the privilege to get to keep thinking about this. So thank you. Okay, well, I'm going to go down in order how these terms are written, and so same two requests. One, if you'd like to work on this section, please feel free to chime in and volunteer yourself. And then two, if you have any comments or feedback on how pieces that could be added to the different terms, please feel free to chime in or send in written comments. So the first term is people living in Oregon. And let's read out the comments for this section. There's two comments. Oh, sorry, the first comment was mine. I mentioned this in our meeting last month. The Oregon Health Authority style guide used to specify that people living in Oregon was a preferred term rather than Oregonian, and that feedback arose from focus group interviews with folks with tribal affiliation who said that the place first terminology and was important to them. And so they might not identify as Oregonian, but they might identify as, say, someone living within the Siletz region. Okay, so this terminology recommendation no longer exists in the Oregon Health Authority style guide, but I wanted to offer it as something that this committee could consider, is how are we going to refer to who this plan is going to serve. And then the second comment, let's see if I can get to it. Uh-oh. Does anyone know how to get to it? How does one get to stacked comments? Oh, here we go. Thank you, Mickey. Oh no, that's not it. Oh gosh, doing so well here. Oh, Jensina asked what is the why here, and I think Jensina is asking us to offer rationale for why we're going to use specific terms rather than Oregonian, which is sort of the common lexicon that folks use. Okay, so I'm going to pause. Does anyone want to offer live comments about how we might refer to the people who are going to be eligible for the Universal Health Plan? And then 2, does anyone want to volunteer for this section? Develop this section.
I see John's hand, and then I see Jensina on stack.
Just real quick, that I've been kind of tracking on some of the other activities of the other committees that Michelle, you spoke about, you know, the other active committees as well as the board. And it does look like in relation to Kim, your question about the terminology here in this specific case, it looks like there are straw proposals kind of out there. And again, I don't know the status of these or what the reaction has been, but it looks like the Universal Health Plan Committee's straw proposal actually leans in on the phrase resident from, I guess, Oregon, you know, it's an Oregon regulation, right? So I'm just kind of wondering if we're at odds with, or if we should sort of start to align with the way eligibility. And Kim, you said yourself, like, this is about who does this involve? It looks like the larger board and one of the other subcommittees, it must be plan design, I'm assuming, are now literally talking about eligibility as framed around residents, as in specifically you reside in Oregon a certain number of days out of the year. So I don't know if I mean, there's nothing wrong with the language that's here. It's just that it seems like if we're going to ultimately align our language or this committee's language with that of the larger enterprise here, that we would start to work in the language of resident as well as these terms. Just a thought, and I'd like to volunteer to also be involved with the ongoing development too. So thank you.
Thanks, John. Thanks for that comment and for your multi-committee tracking and bringing things back to us. That is quite the feat. There's a lot of moving pieces. Appreciate that, and also appreciate the offer to help with this section. Go ahead, Jensina.
So I appreciate the explanation of the why. My question, I think, kind of parallels with John as far as, does somebody need to establish a residency requirement? So if there is a worker who lives somewhere else but has or not necessarily a worker, because they would presumably be covered under workers' comp, but they need medical care, does this actually require residency in Oregon? Like, are we using the term living in Oregon to define residency, or is there more at stake here?
It's a great question, Jensina. And this is where we get into a little bit of a tricky in between, because straw proposals are initial ideas of a direction to explore. So there are no actual final decisions that have been made about eligibility. So far, the intent of the board is to align with residency requirements for eligibility. And I think so there's that piece. And then there's the 2 other pieces are feedback from Indigenous communities who live in Oregon, but actually are citizens of another sovereign tribal nation. They're not necessarily Oregonians, because that is a separate nation state. And then third, this issue of citizenship, right, as a very exclusive term. And Oregon has a long history of expanding eligibility to people who reside in the state and meet residency requirements regardless of immigration status. And that was also something the task force discussed a lot. So I would put all those things on the table as pieces we're wrestling with. And then I will kick it to Mimi with Mickey in stack.
Oh, thank you. Yeah, I think I really appreciate the comment, especially John regarding and Jensina as well, those questions. And I think kind of as Michelle was alluding to, there are going to be specific definitions when the term residence is used, and it will literally be spelled out how it's described in a CFR or an ORS. However, how sort of writ large, how you all decide to speak of living in Oregon. I feel like it's definitely one of those yes and things. So in the proposals around eligibility, it will have to be very precise, almost legal language for some parts of it. However, there is also this great opportunity to kind of bring everyone in and not necessarily have to speak legalese all the time. So that's all I wanted to say. Thank you, though.
Thanks, Mimi. Go ahead, Mickey.
So what I was thinking also is, for example, are houseless community members going to be eligible? And if they are eligible and they are not falling under the state's definition of resident, does that mean then they're not eligible? You know what I mean? So like maybe be careful about saying resident and making sure how is that defined for the state of Oregon? Because it might be like you're registered to vote, you have a mailing address, but if you're houseless, you don't have a mailing address. So that's one thing. And then the other thing is the Compact of Free Association. That's an agreement between the US and Pacific Island nations. And so they're not citizens, but they have an agreement with the US to live, work, and be here in the US. So that's like Micronesia, Marshall Islands, Palau. So they might not be residents technically, they might not be citizens, but they are allowed to live here. So I would just be careful about using those words and making sure we know the definition by the state and the requirements.
Thanks, Mickey. And I think this is flagging a bigger question around when we have a final plan, all of that will be defined and it will be very clear. We don't have that yet. So we may need a way to refer to people in Oregon, like just generally when we talk. And then once we have the plan, we may need to decide how we describe eligibility in the plan. And those may or may not be the same thing or different things. So thanks for all the great pieces of complexity that y'all are lifting up. Go ahead, Colin.
Yeah, it is complex. I wanted to respond to John's noticing that other subcommittees are using potentially different language as far as they're making the plan design and the finance and revenue designs. And I just wanted to say my perspective and sort of a reminder that I think, as a whole group on the communication side, we could choose to holler and say, no, we have to use people living in Oregon instead of Oregon residents. Like we have the power, I believe, as a committee to decide to push that perspective if we chose. I don't think we're choosing that. I just wanted to say, like, at this moment, even though like our communications group is dependent on their final plan, like we can tell them our perspective and what we think is best. I'm concerned about a lot of things, but concerned like on the phrase people in Oregon versus people living in Oregon. It's a little like I'm personally like fairly progressive, and so like I don't want to feel this way, but I have concerns about like the magnet effect of this potential transition to universal healthcare, right? And people coming from out of state to take advantage of our healthcare system or being part of the healthcare system. And the difference between people in Oregon is, people coming from anywhere who are now in Oregon versus people living in Oregon is super different. And then, more concerns about like the finance side. If we're saying that we're taxing Oregon residents or residents of Oregon, but we're giving this to people living in Oregon, those are different things that will definitely raise some concerns for others. That was a little scattered, but I think you know what I'm trying to say.
Yeah, thank you, Colin. And I do want to make sure that we're staying focused on communications guidance and that we're not getting into making eligibility determinations here. They're tricky. It's tricky because they're related, but not the same thing. So we need to figure out how we refer to people in Oregon. And then at a later date, we will have to decide how we describe in plain accessible language that is clear what eligibility looks like for this plan. So keeping those separate might help with simplifying this a little bit, but there's still plenty here to dig into. So, but really keeping this as how do we refer to people in our state is kind of our initial task. And then also Colin, you're absolutely right. We can certainly, when this is finalized, we will be presenting it to the board, asking for their adoption, their formal adoption. And then these terms will be a resource for other committees to use. In addition, some of what the committees get into is going to be so in the weeds, they may not be using our public facing language all the time in their eligibility discussions, but we hope when it's possible that they will. And then when we get the final plans, our intent is to take those plans and use our strategic messaging guide to make sure that they're in our framing and using the language that we have decided upon before taking it for public engagement. So there's going to be a little bit of like, we're going to be translating wonk into something that can go out to the public in an effective way as well at the end of the process, if that makes sense. So yes, and it's going to be both ways. We're going to say, here's the style guide, please utilize it, please approve it, and then implement it. And then when they're like, okay, we really have to talk in wonk to get the level of specificity we need to make these decisions, here's our decisions, then we're going to be taking that wonk and translating it back into normal person language, if that makes sense. So I hope that helps. All right. Any other questions or comments on this part of the document? Thank you so much, Kim. This is such a rich process. All right.
Okay.
Seeing none.
Thanks, Michelle. And John B., even though you have been the only one to volunteer to work on this section, please know that you can also reach out to other resources. You don't have to be a singular brain on it. I certainly consulted some colleagues throughout various programs I've worked with when I was trying to come up with this shell. Okay, thanks for that section. The next terminology section is non-US born persons. And I want to acknowledge that I have worked for the state for a couple of years now. And so a lot of the recommendations are coming straight from state-based style guides, Oregon-based style guides. They don't need to necessarily. I just thought that I would start from a base that is publicly available that folks may have been exposed to before. Okay, so for this section on non-US born persons, we have a comment from Mickey who says, this could feel like, quote, othering, close quote, as focusing on a person's birthplace might make them feel like an outsider or not belonging. It is recommended that we use more specific or person-first language, such as person who is a naturalized citizen, individual who gained citizenship through naturalization, person who became a US citizen through the naturalization process, or person who is a refugee, or individual with refugee status, person who was granted a refugee status. Thoughts? We have a second comment from Jensina, who says, this definition of non-immigrant seems counterintuitive to me. I would expect the non to apply to the entering of the United States, not necessarily the duration of their lawful status. And then regarding the recommendation of avoid using the terms foreigner or alien, Jensina says, as someone born in Seoul who has constantly been referred to as a, quote, alien, close quote, I appreciate this consideration. So thank you, Mickey and Jensina, for your comments. Would anybody like to volunteer to refine this section, or does anyone have comments on other ideas that we might incorporate into this section?
I'm happy to be part of this section. And I also want to just note that for some sections and some communities that there's a that person first language is really helpful and important. And then other settings, like in a lot of disability justice circles, there's a lot of pushback to person first language. So just want to note that. And I really like your idea or your suggestion, Jensina, about being more specific. I think we often get into trouble the more we try to group really big, diverse subgroups of people together. It often doesn't work well. So yes, I'm happy to be part of this and really appreciate the comments on the document, Jensina. And I see your hand. Go ahead.
I think we also need to be mindful of the changing landscape of the federal administration, because it used to be pretty much a given that if you're born in the United States, you're a citizen. And lately now that's up in the air. And so is even the process of naturalization. I'm a naturalized citizen of the United States, and my naturalization holds up as long as my adoption holds up, which right now is also in question because of the South Korea adoption controversy. And so that makes even people like me question resident status, lawful citizen status. So I think that even though Oregon is a sanctuary state and we are definitely more progressive than a lot of things, I think we need to be very cognizant of how the federal administration currently defines things and how we can ensure that protection is built into this particular style guide.
Yeah, thanks for that note, Jensina. And I think we do have a standing agenda item, just so you all know, at the board level of federal updates. So far, many things have been proposed, but as you were just referring to, Jensina, many of them are unsettled at this point. And so the board's position so far is that it would be a waste of our resources and time to try to respond to all the proposals. When things become law, settled law or fact, we will take them into consideration. And part of implementing this plan is obtaining federal waivers. And that will, of course, have to respond to whatever the reality is of the federal policy landscape. So I think we can be sensitive to that context, and our job is to write a style guide and write a plan that works best for the people who live in our state. And then implementation might be figuring out how much of that is possible within in a particular time and place, in a particular time and policy landscape. So we'll be presenting this to the legislature in September of 2026, and the legislature will have to determine the next step in terms of implementation timeline and resource allocation and those types of things. So just want to say all of that we have to be aware of it, and there's not a lot that we can say, okay, this is now the durable policy of the United States has changed in this way, and so we must change our plan in this other way. There's just a lot of uncertainty. So I think it's important to acknowledge that. And as laws change and as federal funding changes, those are updates that will be coming to the board. And if you all want, to the degree that that's helpful to you all, would love your feedback maybe at the end of this meeting about whether you want any of those updates to then come to this committee, if any come to the board, so we can all track it together. I think that might be a great way to accommodate exactly what you're pointing to, Jensina, because these are things we are all seeing and experiencing that are impacting us and our communities. So trying to strike that balance, right, of responding to what's real and acknowledging the level of uncertainty that is also already impacting us. Thank you. Kim, I think I'm not seeing any other hands, so back to you.
Thanks, Michelle. Jensina, not to put you on the spot too much, but you have, I know you're smiling, you know exactly what I'm going to ask. Would you like to work with Michelle on this section? I like the perspective that you've brought. You're smiling.
Sure.
I can.
Sure.
Thank you, Jensina. Okay. So our next term is regarding health insurance status. And so this one I thought was really important because uninsured is a term that we don't tend to want to use in this space. And so I didn't offer any specific shell recommendations, but if anybody has thoughts that they want to share about how we might refer to or how we might create guidance around people with insurance, people without insurance. We had folks mention that we refer to people who are underinsured or people insured by commercial, private insurance, Medicare, Medicaid. I think that this is a term that this group and certainly our consultants can help to should strongly consider including in the style guide. So I'm going to pause there and ask for verbal thoughts or folks who might want to help develop this. And then let me read out the comments that people have shared. So the first thing that I pointed out was that I looked through various state websites, such as Healthier Oregon and Oregon Health Plan, and neither of those websites offered guidance on how to refer to people who they cover, such as by saying member or beneficiary or enrollee, although member does seem to be a fairly common term. Mickey responded and said, yes, please, to person first language that is considered respectful and inclusive. And we have one more. And then Jensina also for the section said that the binary people with insurance, close quote, or quote, people without insurance, close quote, leaves a lot of uncovered ground in the middle. In healthcare, we frequently refer to the quote, underinsured, close quote, which includes those who have some form of insurance, but it doesn't begin to cover nearly enough. Thank you. And I'm going to pause for hands.
And I see Mimi's hands.
Thanks. I was just going to add in there, certainly just for my time working for our health plans frequently refer to people as members. And I'm just going to toss out one other way to refer to people, which is actually what's used by PACE programs, which are programs for the elderly, as participants, which is sort of a neutral type of word, just for your consideration. That's all.
Thank you, Director McDonald. I'll also throw out there's an idea in a lot of health justice work around pushing back on the idea of healthcare as a commodity, which is embedded in a lot of the language that is used in healthcare. And similarly pushing back on the idea of those of us who need healthcare to live healthy, fulfilling lives as quote unquote consumers of some kind. So just want to make sure maybe we don't mirror that language to align ourselves with the right to healthcare that is in the Oregon State Constitution. So thinking about that in this mix. Any other questions or comments along these lines? Colin.
I wish there was one single people first phrase to say that would encompass all groups, but I think that right now the best way to say it is like, is this people with insurance, people without insurance, people who are underinsured, people who have private insurance, people who have publicly funded insurance, you know, and it's cumbersome. So it'd be nice if there was something else.
Thanks for that reflection, Colin. It really makes me think that maybe on like the second page of this document, we need some kind of there's trade-offs when we make these decisions. So there's specificity and then there's accessibility, and often there's a tension, and we have to make a decision about like where we land on that continuum for everything we talk about. And there are equity considerations for accessibility, and there are equity considerations for specificity, right? Because if we're too general, then we're vague, and then that doesn't aid in getting good feedback because people don't know what we're talking about. So thinking about what those trade-offs are and acknowledging them. And I think to a lot of the comments that have been made here, explaining why we made the choices we did briefly when it's appropriate or helpful might help the rest of the board find this document to be more useful, because you're right, that is cumbersome and it's also really specific, and that's helpful in creating clarity. Other comments on this portion of the document? Go ahead, John.
Just kind of a quick thought on what you shared about that tension between being too general versus too specific, or to be relevant or useful. Is what in each of these cases, what my mind naturally goes to is where down the line would this have practical use for our stakeholders, right? Or whether it's us, our stakeholders, members of the board, and so forth. And so, what's crossing my mind, I think, and during another comment also on this topic of kind of uninsured versus uninsured, or Medicare, who's on Medicare, is at some point down the line, I can envision a document, whether it's created by this committee or by a consultant, that kind of says, hey, look, which of the following best describes you? I'm on Medicare. How does this change affect you? This move to universal health, Oregon Universal Health Plan, how does it affect you? Bam, this is the following. I'm on Oregon Health Plan. How does this affect me? I'm on private insurance. How does this affect me? So I'm starting to kind of fast forward and instead of just kind of abstracting these as kind of things to discuss, in a more universal context, thinking not in terms of specificity of the population, but the specificity of our circumstances, and saying, where will this be useful down the line? So, I mean, I think I would naturally be inclined to start to break that down in ways that end the audience, the specific audience segments who maybe are in one of those places, whether it's underinsured, Medicare, Oregon Health Plan, on the buying healthcare on the exchange, and start to break that down in ways that somewhere in the future we can then talk about the implications for each of those populations, if the plan, once we have more details on the plan itself, I guess. Sorry, that was a very long, meandering thought.
Thanks, John. Yeah, I mean, what you're pointing to is really valid as well, that we're going to have to tailor whatever we're saying to whoever we're saying to at times, right? So this will be general guidance. If we're meeting with a bunch of healthcare CEOs, our language is going to be different than if we were meeting with a group of community members who are on OHP and Medicare in Grant County, right? So certainly that will be a component, but I think this will be kind of the general guidance that would be the starting point, and then we can customize from there as appropriate. But I really appreciate that. That will be part of our task. Anyone else? All right, back to you, Kim.
Thanks, Michelle. So last goal, does anyone want to volunteer to work on this particular section? You don't need to raise your hand now, but certainly I hope folks will like to band together for this.
I see
I
Colin has
volunteered.
his hand up.
Yep.
Go ahead, Colin. Were you going to say something, or are you just
Oh,
volunteering?
I volunteer.
Thank you.
Okay, thank you, everyone. So we do have a couple more terms, and I also want to ask Mimi how our time is going in case folks want to take a break or a bio break, because we're about to get into pretty weighty sections here. Mimi, how are we doing on time? And I also want to make sure that folks are starting. Okay, we're doing great. All right. Well, I'm going to carry on, but if it's getting a little bit heavy, then we can take a break. We also don't need to finish going through this in its entirety. The staff members who are going to succeed me are certainly capable of taking this on. Okay, so thanks everyone for sticking with me. Our next term is around people receiving care. So this is different from, say, people who are this previous one, people who the health insurance status. So for example, in a lot of the work that I do, we try to avoid using the term patient, especially because a lot of my focus is on gender affirming care, and we don't want to say that gender affirming care is a pathologizing version of care. And so we don't like to use the term patient in the way that we refer to members or beneficiaries or people who are receiving these services. And so that's why I wanted to recommend that the committee creates guidance around how we're going to refer, how this program is going to refer to people receiving care. Does anybody have thoughts off the top of their mind that they'd like to share today? And then I don't think there was one comment from Nikki on this idea, on this concept of people receiving care. And Mickey says, yes, please, to person first language, as that is considered respectful and inclusive. I wish that I could stay on as like a member of this committee, because I would so volunteer to work on this section. But in my absence, if anyone would like to volunteer to work in the section, or if they have comments that they would like me to record, I would be happy to put them here.
I'm happy to work on it with anyone who would like to join me. And I want to know if anyone else has any comments or wants to be part of looking into this section.
Okay, well, it's okay if folks don't want to raise their hands yet today. I hope that you'll give yourselves some time to chew on this concept. The next section that we're going to visit now is a bigger one, and I know that there are people in this committee with lived experience and very strong and good ideas about what we can include here. So our next section is around disability. Again, the framework that I included here is based on Oregon Health Authority based recommendations, but it doesn't need to be, because the Oregon Health Authority is separate than the Universal Health Plan program. So, so we don't need to hew to their particular guidance if we don't want to. And so we have comments from Amy and others, which I'll go ahead and read out. Amy Fellows, your co-chair, says, I would love to see the language be a little more neutral and make clear that there is definitely a movement, especially in autistic and neurodivergent communities, to use identity first language rather than person first language, which I put in as sort of the starting recommendation. And Amy says, including my 16-year-old and the neurodivergent teens that they interact with. Amy also says, I found this on the NIH, National Institutes for Health, which is recognizing the movement around identity first language. When I write about disability, I tend to alternate use of identity first language, IFL, and person first language, PFL, and make clear to ask the individual their preference. And then Mickey also offered another education source to piggyback off of. And then Mickey shared a quote from that says, the best practice is the most respectful approach is to ask individuals how they prefer to be identified and use the language they choose. This demonstrates respect for their self-identification and acknowledges their individual preferences. So those are the comments that have been shared within the section on disability. I think since I don't want to volunteer Amy since Amy's not here to speak for herself, but does anyone also want to offer ideas here that we can record for Amy and others who are absent to see, as well as volunteer to work on the section? Amy actually has expressed to me that she'd like to help guide this section. So I'm not going to write down her name now in her absence, but I do know she's interested in this.
I will give her a friendly nomination to work on this section, and she can decline it, of course, if she would like. I do know that she's very passionate and knowledgeable in this area. Go ahead, Mickey.
I have a question. So when you're saying you want to help on this in this section, what do you mean? Like to define it? To come up with definition?
Yeah,
Like,
to come up with guidance on how we refer to disability. Yeah.
Oh, okay. I can help with every section if you guys want to add me to anything and everything. I'll review everything and provide support. Did Colin just raise his hands for everything too?
No, I did not. I was saying, good job, Mickey.
That was close, Colin.
Thank you.
Thank you, Mickey. That's very generous. I appreciate that. Go ahead, Max.
Yeah, I would love to volunteer also for the disability section, and I can also volunteer for the people receiving care section above as well. Sorry, I didn't have an opportunity to raise a hand when there was that pause there, but definitely got like a lot of experience in both areas, and would really love to work and collaborate with you all. The disability one's going to be a tough one for sure because of the various parts there. So how you do that in written discourse and not like in the conversation. Those are definitely best practices for the conversation, but how do you do that in written discourse will definitely be a something to really unpack with the group for sure. Thanks.
Thanks, Max. And yes, thank you for really pointing out that delineation between our guidance for written versus our guidance for an interaction. So yes. Wonderful. I am also happy to work on this section. Anyone else? Any other questions or comments? And I will just say, if later when we send out an updated draft, you didn't volunteer for a specific section, but you have thoughts, we want those thoughts. Like, I hope that this feels like inviting you in, like we won't move forward without consulting with you if you have put your name forward, but it doesn't mean that if you didn't put your name forward that we don't want to hear from you on that section. So also just want to say, like, in future drafts, we welcome everyone's feedback on any section. But this is helpful to know if we've heard from everybody before signing off on a next version of this document. So, all right, back to you, Kim.
Thanks, Michelle. And Mickey, I'm right there with you. If I got to stay on this project, I would have volunteered for everything. Okay, our next section is around substance use disorder. I offered some recommendations again from the Oregon Health Authority writing style guide, which uses very person-first language for this. So thoughts or volunteering? Michelle's cat is volunteering for all of this. I am reading the body language happening here.
I will just volunteer myself for any sections that don't have anyone specifically assigned to them.
Thanks, Michelle. Would anyone else like to work with Michelle on this section? Or do you have thoughts that you'd like to share? Okay, it's okay if not. Our next recommended term, and again, these are just terms that I came up with. Please feel free to say we don't need to have this term in here, and we can delete it out. Our next terminology is around health inequities, and Jensina asked if when we speak about folks, instead of using the term underserved, Jensina, you're so good with specific language. Jensina offers, how about, quote, people who lack access to blank resource, unquote. Love that. And that's definitely aligned with the recommendations that the Oregon Health Authority and State of Oregon Diversity, Equity, and Inclusion Action Plan say. So one of the considerations that isn't directly written into this is that one of the terms that used to be used is talking about health disparities. And we've shifted from talking about disparity to inequity to reflect that certain communities receive less. And that is where the inequity is arising from, is that certain people, certain communities are receiving less because of structural, institutional, social creations. And so that idea about not using the term disparity, but rather referring to inequities, isn't reflected here, but could be something that the committee considers visiting in this. So I just wanted to state that verbally. I don't need to write it down. But do we have any volunteers to work on the section, or any additional thoughts about the section? We're doing great. I know we're an hour and a half in, and folks are being champions.
Go ahead, Jensina.
Well, I personally lack access to Michelle's cat. But my husband actually is a health equity specialist for Trillium Health Plan. So it's one of the Centene Medicaid plans in Oregon. And he shares my office, which is frustrating and annoying because he's loud. But there's that aside, one term that I frequently hear him referring to when he's talking about the health inequities and the disparities is making sure that we're identifying the inequitable access. So not just necessarily that there's a lack of access, because there is that, but also that there is a lack of access that somebody sitting right next to them may have perfect access to. And I don't know necessarily how to make that a person-centered statement, but it really speaks to that whole idea of, equity is not the same thing as equality. And so making sure that we have that in mind as we're comparing these different populations, I think will be helpful, and especially as we provide the style guide to the board.
Thanks, Jensina. My cat would love to share all of their cuddles with you. So I don't know how we can make that happen, but there's plenty to go around. Just so everyone knows, the board did adopt principles and values that guide the board's work. And the first primary principle is a health equity definition that very clearly is aligned with definitions of equity versus equality. I would actually say when it comes to health inequities, I would not personally, at least based on what I know in this moment, wouldn't push for a person-centered language, because I think that individualizes a systemic problem and invisibilizes the institution's role in the creation of disparities. And so I would actually, some of the terminology that we use are, people most impacted by systemic inequalities, right? Like the inequalities are in the system, they're not in the person. So whether that resonates with folks, that's what I would throw out, at least for the initial discussion. Mimi, go ahead. And then I see Mickey and Stuck.
Yeah, thank you. And I'm just curious what people think about, kind of in the same vein that you were talking about, maybe referring to times when this is going to be used in a written form versus an oral form, in times when some of this verbiage will be used on an individual level and also on a population level or on a population level. And if for some of these definitions, I think having that in there may be helpful, or sort of when this might be appropriate, because it may be appropriate to use some words referring to a population and not necessarily referring to an individual. So I'm just kind of putting that out there as everyone is thinking about this.
Thank you. That's great. Go ahead, Mickey.
Oh, speaking on about equity, I wonder if it's appropriate to also include in this style guide culturally and linguistically competent or responsive. Moving forward, as we can see today, there's underutilization because of lack of culturally and linguistically specific services and programs. And you're seeing a high cost and high visits to emergency care. And there's not a lot of preventative care. So I could see moving forward that there's going to be some lessons learned that hopefully will be implemented into the future universal health plan. And key to that would be culturally and linguistically specific program services. They call it competent, responsive, those sort of things as well.
Thank you, Mickey. Yeah, specific, culturally specific. Yeah, we definitely should add those terms to the document. Thank you for that. Colin?
Going back 30 seconds to the people lacking access. I really like both Jensina's comment about people who lack access to care. And I also, Michelle, really appreciate you saying that in this case, maybe person first language isn't appropriate, because it is systemic. So I can't say verbatim what you said, but people who have been disproportionately affected by this systemic inequitable system. I liked that kind of phrase. So
thanks for that feedback, Colin. And go ahead, Mickey.
Oh, I'm sorry. I was just responding to Kim. Yes, Kim. Sounds good. Thank you.
That was amazing. Live in a public meeting, we had someone get asked if they could volunteer in the document, and then a live yes. So that was very efficient. Thanks, y'all. Any other comments on this section? Thanks, Kim, for capturing all this in real time for us.
Favorite committee. You all are amazing. Okay, thank you. If there are no final thoughts on the section around health inequities, as well as if folks want to respond to Mickey's awesome idea around adding terminology and guidance around culturally and linguistically appropriate blank, please feel free to volunteer for this too. Mickey, I hope that the smiley face helped. Okay, thanks, Mickey. All right, our next term is around guidance around using the term, using terms regarding houselessness. One of the comments in this section is from Mickey, and Mickey asked, from what I gather, houseless versus homeless, because people have a home where home, and then in parentheses, home is where your heart is, but they don't live in a house while being an individual experiencing houselessness. And Jensina asked if, is the term unhoused obsolete now? So this is probably another section that might elicit strong responses. And so if folks want to either volunteer or offer some feedback, live feedback on this section, please feel free.
I could volunteer on that one too.
Thanks, Mickey.
I'm going to the National Alliance on Ending Homelessness this weekend, so I'll see what they have as well.
That's awesome. What a great resource. Thank you. I'm also happy to help on this section. We have a housing and transit work group in Southern Oregon that I'm a part of or connected to, that I could also ask for some feedback.
Okay, thank you. If there are no other hands, and I know people have been total troopers in sticking with this, we have 2 more terms to visit today. And again, if you want to get a gold star like Mickey and offer more terms to add, please do feel free. The second to last term is around corrections. And so I borrowed some guidance from the Oregon Health Authority writing style guide, but if folks want to offer different recommendations or offer to work on this, please feel free.
This might be a silly question, but is the term justice involved not one that is used anymore?
So it wasn't specifically called out in the Oregon Health Authority writing style guide, but I am not sure actually how what the current status of that is. All right.
Something that I hear a lot in my work, but I work in a more rural area, so sometimes we don't have, sometimes things are still in use that maybe shouldn't be, so that's why I'm asking.
Thanks. Yeah, certainly something to capture. Okay, don't need to volunteer, but Mickey, it might all fall on you and Michelle. Okay, other feedback on the section on corrections? Okay, if not, the last term that I wanted to offer here is one that I feel pretty strongly about, because I know a lot of people say it and I sort of cringe when I hear it being said, but the term stakeholder is one of those terms that is recommended to not be used anymore. And so one of what we might offer instead is that depending on whom you're speaking to, the terms that you can use are collaborators, program partners, interested groups, allies, and other terms that aren't quite this stakeholder term. So I did want to put that on people's radar, and I titled this term relationships and partnerships. Colin asked for this section, does collaborators include providers and clinicians? They aren't specifically listed here, but they will definitely need to be referred to in our communication. Colin, definitely yes. And that we can add that to the idea of alternative terms. Just you know, the recommendation is to be specific when you talk about who you're working with. Maybe you're working with a community advisory board, who under the old definition would certainly be included as a stakeholder or a partner, but they're a community advisory board. So let's just refer to them as a community advisory board. Yeah, so I just wanted to include this as a term. I do think it's important to include, but if anyone thinks otherwise, please feel free to share opposition. Happy to record it.
Anyone have any questions or comments on this last section? I would just say, I think this might be a place where it would be really important and helpful to explain why the word stakeholder is being recommended to be phased out. Because it is one that seems so innocuous to many people. And I don't think outside of a few circles, I don't think this is a conversation that's happening widely enough for a lot of people to come in contact with it yet. So I think a why would be helpful.
Definitely. Michelle, I'll go ahead and add that in before I circulate this next version. But yeah, for folks on the call, it has roots in colonization related terms. And so it's recommended to not use this term anymore.
I see Jensina. Go ahead, Jensina.
So for me, I agree with not using the term stakeholder. My reason is a little bit different though, because to me, it's way too close to the term shareholder. And with all of the things going on with third-party insurances like United Healthcare, everyone knows that the CEO of United Healthcare was murdered because his shareholders needed him to create more of a profit. And so I really definitely agree with why stakeholder is not a great term, but for a slightly different reason.
Thanks, Jensina. Any other additional comments in this section? I feel I heard through this conversation some kind of overarching recommendations that could maybe go in a beginning section. That's like kind of general guidance, like be specific when possible. If you're in a conversation with an individual, ask them, like follow their lead for how they self-identify, use plain language, avoid language that might blame a person for a systemic problem, avoid language that may reinforce the healthcare as a commodity, people accessing healthcare as consumer kind of framing. Like there might be some things that rise up as we go through all the specifics that become kind of general, like here's how we think about and where we came up with some of this. Like here are some kind of guiding principles maybe is what I'm thinking about. And yeah, so I'm curious if there's anything else that's come up for folks, and then we'll go to a break. As we've gone through this very detailed discussion, are there things that are rising to the top? Go ahead, Jensina.
So I will fully admit I've been preparing this soapbox for a minute. I had the privilege of attending the Healthcare for All Oregon conference because it was held in Eugene. And Colin, by the way, I did talk with Valdez, so don't worry, it's already at that level. But so I attended one of the breakout sessions. It was how to discuss HCAO with the communities in the rural red areas. And so I attended that thinking that it was going to be collaborative. How do we really push the word out to folks who maybe haven't received a whole lot of benefit statements regarding universal health care? And what it turned into, it devolved horribly into a conversation about, well, with the Republicans, you can't use words longer than 5 syllables. Like that was literally said. it was things like, you know, they just don't understand it. They all think, and the term the they kept being used so much. And it was really offensive. It was divisive. One person said, you know, I'm a Democrat and I take offense to what you're saying. And then another person said, well, I'm a Democrat and I think you're just spot on with what you're saying because these people aren't reasonable. Like there were so many terms about they and these people and them. And so at the end of it, before we came back to the general session, I actually outed myself and I said, I am a rural red Republican and I believe in healthcare for all, but I really don't appreciate the condescension, the patronizing, the assumption that Democrats own the monopoly on college education, on caring for other people, on being decent human beings. So I was very, very disappointed in that breakout session. And honestly, as an Asian woman, I have actually never ever felt so othered by a group of people. It was really, really distressing to me. And so I want to make sure that this committee is positioned to not make the same missteps. And so if that means adding a portion in the style guide for talking with folks who have different political outlooks or who have different experiences, who have heard different things about healthcare for all and how it could affect them and their livelihoods and their families and things like that, just so that we don't put other people in the position that I was in at the HCAO conference.
Wow, thanks for sharing that experience, Jensina. And as someone who grew up in and has always lived in rural communities, I think that's really important. I think that, of course, the Universal Health Plan Governance Board and this committee, we are apolitical explicitly, and that is not just a legal requirement, that's a deep commitment for that reason, because our job is to respect and serve all Oregonians, regardless of whether they have a political identity or what it is. And so, yes, I think we need to maybe add a section on how to think about and talk about how to communicate about the urban-rural divide, since so much healthcare policy making happens in the urban centers of the state. That has implications for how healthcare policy is received and thought about in rural communities as something that is forced on us by them, right? There's also the them that goes the other way. So yeah, I think something around that, maybe not as explicitly political, because I don't think that's appropriate to our role, but something that points to how to talk respectfully across the urban-rural divide and acknowledge the different realities and bubbles that we live in and communicate in. Also, maybe a section on implicit bias, which we all carry, right? In different ways. So if someone grew up in Central Oregon, where I live, they may have a bias about all kinds of things. People who live in Portland, for example. And if you grew up in Portland and you've never lived outside of Portland, you might have ideas about my neighborhood, right? My community. So I think that goes beyond, like, those two things were what was coming to mind for me. Making sure that we're all aware of when we communicate, and making sure that anything that's going out is bubble proof, that we are not writing entire documents within a bubble and not testing them outside of that bubble and then trying to go out and do engagement across the state. That's, thank you. That was really concrete and sad to hear. I'm sorry that happened, but very instructive for our work. Go ahead, Colin.
Thanks. Yeah, I raised my hand for something different, but I'd like to respond to Jensina, which is also, yeah, to echo Michelle, it is sad that experience of othering happened at the conference that I helped to plan. And yeah, and also better that it happened now instead of next year, like that kind of problem can't happen. I mean, it will continue to happen. I think that so many people in Healthcare for All Oregon and other people around the state are very familiar with our silos and our echo chambers and our bubbles, and that's just, it's 2025, like we got to move forward. So Jensina, I'm looking forward to talking to you a lot more actually about this. Cool, I raised my hand for something else in the style guide, which was that I think I'd like to have the option of using the phrase Oregon Universal Health Plan, because I think sometimes it's more clear than a universal health plan, because we're not actually making a universal health plan, we're making an Oregon Universal Health Plan. So that's something earlier in the comments that I wanted to bring up again.
Great. Specificity again. Thank you, Colin. All right. This has been such a rich discussion. I really, really appreciate everyone's time and thoughtfulness and courage. Sometimes like asking questions or throwing ideas out there can feel vulnerable. It's always safer to stay silent. So I just appreciate everyone's engagement. And if you're someone who wishes to engage in written format rather than live, that is welcome, of course, as well. Any final comments? All right. Kim, any wrap-up comments or questions from your perspective?
No, thanks. I really appreciate how engaged everyone was. I know it was a long conversation, and we did get through the terminology section. Again, this is a living document, so it doesn't need to be solved on a specific timeline, although we would like it to be socialized amongst the board when it is ready. And the UHPGB staff are going to lead it in my absence. So thank you for letting me introduce you all to this idea of a style guide document. I think the next steps, at least from the staff side, will be I have one section to work on, which is to offer some rationale for why the term stakeholder might not be appropriate to use anymore. And then I will share this with my colleagues. I think we can get it translated and then sent back out to the committee so that folks can see everyone's comments that I've recorded here, and then feel free to submit more written feedback if that is helpful, and to see who's working on specific, who's volunteered or been voluntold to work on specific sections. Thank you, everyone. I've so appreciated getting to work with you these past few months, and I'm going to head us over to a break, I think. Mimi, I'll give it back to you.
Sounds good. Would everyone be okay with a little bit shorter break, maybe coming back at 3:20? So just a little quick 6-minute break. Is that sufficient? We don't have too much left to go after that. Does that sound good? Okay, so I'll see you back at 3:20.
It is 3:20. If you are able to come back to your computer and turn on your camera, even if just briefly to let us know you're back, that would be great. We're going to jump into the last half of our meeting, which I think will be a lot shorter than the first half. So final stretch here. Thanks, everyone. And I'm going to turn it over to Director McDonald to get us started on this agenda item.
Isabel, will you let me share my screen? We may do a little real-time updating. We'll see how that goes. Great. So we'll get up there. Just sort of the work plan and timeline, which this too is kind of an ongoing work in progress, but just to kind of remind folks about some of the deliverables and some of the things that you all decided were going to be part of what you gap analysis that happened back in the day. I just happened to start this in June, so that's why it gets a box there in June. And if we look to kind of where we're at now, feedback to board and committees, we just now have brought on Wentz Consulting. So Patty Wentz is going to be able to help with that. So in addition to working with this committee, Patty will also be working with the board as well with 1 or 2 training sessions for communication work. Underneath that, I have the style guide, which you all have been working on diligently. I think I just may have to do some merging of cells, because I think the style guide work is going to go on longer. So now we'll just kind of put it out there until August or so. And of course, Patty will be working on this communication plan. And I think the thing that I just wanted to call into consideration, Diana Bianco we'll begin in September working on developing a plan for these targeted presentations. So these are the ones that have been sort of not requested, but are part of the deliverables that are required to the different groups, such as which I think there's 10. I apologize, I don't have them off the top of my head, but including, of course, living in Oregon, healthcare providers, persons with disabilities, etc. So these targeted presentations. So that is not the intention of everyone living in Oregon, but these groups where the parts of the plan have been developed will be shared with these groups, and this is really the opportunity then to get the feedback. As Michelle was talking about, this is what a huge part of the work that this committee is doing, is to really be able to put forward the work that's happening, really hear from all different groups.
Mimi,
the different committee works. Yeah.
I'm so sorry. You're cutting out, at least for me. Are other folks hearing that? I'm seeing a nod from
I
Colin.
apologize. Let me go.
Yeah.
Let me go off camera. My apologies. I'll just kind of leave it at that because I'm so sorry. But if there are any egregious areas where you think, no, this is not right, I need to talk about this, Michelle, I'll let you kind of lead that part of the discussion.
You are a lot more coming through a lot more clearly, at least for me, without the video feed. I'm so sorry, Mimi. I know that's frustrating. But thank you for this visual. So does anyone have any clarifying questions or anything that you think maybe needs to be adjusted in our timeline? Does this make sense to folks? Go ahead, Colin.
Yeah, if I'm remembering from previous timelines, we talked about our committee having like between January and March as like our main, when I've held that in my mind as like, oh, January to March 2026 is when we do a lot of our outreach. And so just confirming that that is part of the Bianco like obligation, or yeah. And also, I haven't checked in with an actual board meeting for 2 months, right? So I know that there was some discussion 6 months ago about like having potentially some of our community engagement outreach sessions maybe connected with 1 official or 2 official UHPGB meetings. So yes, any more clarification that I could have about what's going to happen?
Great question. Thank you, Colin. So Bianco Consulting is definitely, let me back up. All of this is subject to change. Our best guess right now is that we will have draft plans from the other committees ready to take to Patty for strategic framing and messaging, and then take to Diana Bianco to formulate questions regarding the plans with all of you, starting next October, November-ish. And then, yes, we would be then ready to do that engagement, and Diana will be leading that engagement, scheduling that engagement, facilitating those sessions, doing some, framing the questions with all of you, those types of activities. That is part of her contract. So this is our best guess now, is that, and maybe it's optimistic still, we'll have to see, that would be wrapped up by the end of February. That could fudge a little bit later, if depending on what happens with the draft plans and how the engagement goes and how quickly we can schedule these groups. But yes, the Diana Bianco Consulting timeframe from September through February essentially covers, at the beginning of that, question formulation with all of you. So here are the draft plans. Here are the questions we might ask. What do you all think is working with Patty to make sure it's framed up correctly? And then scheduling those meetings, deciding within those, that list of groups of folks that we are mandated by law to engage with, deciding which specific entities get the invitation, right? The opportunity invitation, since we can't consult with all business owners or all healthcare professionals. actually like implementing that to get to the 10 facilitated sessions. It's a 10 plus, it's a minimum of 10, and then holding those sessions and then writing up the notes and basically, you know, debriefing them, bringing that feedback back to the committees. Right now it's scheduled to happen by the end of February. So yes, we're still kind of on for that time frame. And every month, Amy and I go to the board meeting and we ask, we're probably annoying at this point, but every single month we ask, are we still on for this timeline? Has anything changed? And that's just so that we can pivot as needed, right? So we will keep asking that question and being that person in the board meeting and bringing up back any changes that might happen. And of course, Executive Director Mimi is there as well to make any adjustments to this timeline. So thank you, Mimi, for all the work on this. Go ahead, John.
So this, I guess, just to follow up on what you just shared, a logistics question with respect to both the charge of this committee and kind of larger effort. You mentioned a second ago, Michelle, that we anticipate the facilitated sessions to finish sometime, minimum of 10, finish around February 2026. Is that right? Ish, yeah. And so, I guess the related question is, if the committee work and the board planning is literally, it looks like it's, and I see that slot there under communication plan, the board plan final in March. Does that mean that some of this feedback that will be collected during those minimum of 10 sessions, there'll be a window of time in which that feedback could be used to inform the plan itself? Because it kind of, looking at the timeline, I'm wondering, like, will there be time? Or because it certainly looks like the other committees are hard at work on really concrete, detailed features of the plan, eligibility, and so on and so forth. So by the time we're able to sort of get back to them with feedback from these facilitated sessions in February, realistically, or I mean, is that time to like inform anything from plan design to finance or anything else? Like what could realistically, how could the ship be kind of turned, or could the trajectory of the board's final plan and the shape of the plan and so forth, could it change based on that feedback? I guess
Yes.
is what I'm getting at.
That is the explicit intent.
Okay.
And so that will be our charge, is to make sure that that feedback gets back to the board and to the other committees and gets lifted up so it can be incorporated in a revised plan. And then once we have that feedback incorporated into a revised plan, we will also be, do you remember that list that you all worked on last fall of other groups across Oregon that might be interested in this work? So
Yes.
Patty Wentz is helping us with our immediate communications needs, with our backlog of communications needs, and getting some of the basic materials in place. Part of her contract is to write a request for proposals for a second communications consultant that would come in and work with us in 2026 to make sure that the final plan incorporates all of the strategic messaging, strategic framing, elements of our style guide, feedback from our engagement, and then that plan, even though we don't have the funding and the time to do the statewide media campaign and listening sessions all everywhere like we all would like to do, or I would like to do, that second communications consultant would help us to send that plan out, that second version that already has some feedback, to say, this is the work that the board has done. This is what's going to be presented to the legislature, just so that people have an opportunity to look at it, because no one's going to watch the legislative hearing where our board co-chairs present the final plan to the legislature. No one's going to read the, huge report we submit to the legislature outside of those legislators. So there will be some, that is what this dissemination plan creation with consultant and committee piece is. So all of this is iterative, but to answer your question, yes, we will finish our engagement. It'll be as we're having these meetings. So say we have our first meeting in December, optimistically, or at the beginning of January. we get insights back from that engagement, then I think that depending on what the feedback is and what it pertains to, that could go specific directly to the committee that worked on that piece of the plan immediately. We don't have to wait till the very end to give all the feedback at once. It can happen in real time. So they're working on, okay, this is some feedback we got on the 10th. Here's some feedback we got on the 16th. Here's some feedback we got on the 25th, right? It will continue to be this back and forth process between our committee and consultants and the other committees and their consultants, if that makes sense. But yeah, we are not going to go out and ask people for their feedback and then ignore it. It's very important. Very good question. Thank you. Any other questions? And thank you, Mimi. I saw you nodding. Really appreciate staff's
Yes.
role in helping facilitate all this committee to committee communication and coordination.
Absolutely. Thank you all so much. And those are all great points. I'm going to stop sharing.
All right. If you do have questions about that timeline and you didn't get a chance to ask, feel free to follow up with email or just raise your hand. But we will move on, not seeing any hands, to committee member updates. So again, this is just an informal opportunity for each of you to share any updates you might have about engagement that you are doing. If you have any updates to share. So open it up. Maybe we had a quiet month. Colin?
I can share. My raise hand button is obscured, so here's my physical hand. Yeah, we talked briefly about the Healthcare for All Oregon annual meeting and conference, which was in Eugene on June 7th. I thought it overall was really good, and I walked away knowing that there was a lot of room for improvement, and now I know that there's even more room for more improvement, which was nobody's surprised. We had 3 members of the board give a brief update in the afternoon. Amy Fellows, Chunwei Chi, and Mary Lou Henrich, who's a member of the Healthcare for All Oregon board. So that's the board participation in that meeting. We had about 100 attendees. Next year, we're aiming to have our meeting in the Portland area, which will mean that we'll need to have even more of a dedicated effort to bring people from rural Oregon in to the sessions. And it was really good. It was engaging, and I was glad to be a part of it. As far as like more outreach, Healthcare for All Oregon is doing more of our community conversation sessions around the state. So we've been going to different places, like a church in Seaside or somewhere in Salem. We're speaking to a group in Forest Grove this Friday. Anyway, so just more spreading the Healthcare for All Oregon perspective on the work of the governance board and the path to universal healthcare, more than zero. So feels good.
Thanks, Colin. And I hope that at some point there could be if part of the intent is to engage with rural communities, there could be like a Southern Oregon one and an Eastern Oregon one and a Central Oregon one. I know that for me, the travel just wasn't possible. But yeah, appreciate that comment. Go ahead, John. I think your hand was up.
Yeah, this is just a really good question. Michelle, a minute ago, you mentioned that resource document that we had all contributed to last year, a list of potential, organizations, groups that we should, consider. And I have to admit, like, I've been kind of keeping a list since then of things that have come up. I've heard someone mention that might be a good idea. Is there a way to revisit that sheet? I believe it was like, and I don't remember if it was an online document or if we were emailing things in. Is there a way to feed more potential audiences into that resource, or how would that work?
Yes. I think when we soft finished it, we said it would be a living document and we wanted folks to continue to add to it. So I would just look to staff. I see Mimi came on camera and is nodding. Did you want to speak to that, or is that something we should just follow up on?
Yeah, absolutely. Everyone always welcome just to send an email, either the DCBS info one or my email or Isabel's, and we will certainly add to it. And then at some point, whenever y'all are interested, or when it's like back in, so people can have eyes on it again.
Perfect. Thank you, John, for bringing that back to us. And I know that we were also going to ask our really experienced consultants who do a lot of engagement work related to health policy to see who we might be missing on those lists as well. So let's all keep adding to it. Really appreciate that. Any other committee member updates? All right, hearing none, we will move to meeting reflection and future topics. So again, just really wanting to set time aside every meeting to pause and ask you all how these meetings are feeling, what's working for you, what you feel like is missing or could be improved. Anyone have any meeting reflections or anything that you would like to prioritize for future meetings? And also just to say, at some of our upcoming meetings, we anticipate drafts from Patty Wentz coming back to y'all. Here's an FAQ, here's the one pager, here's a plain language public facing version of our values and principles. Here is some key messaging and framing for our work, those types of things. So much more active phase of our committee when it comes to the communications drafts that will be coming back to you all. But aside from that, would welcome any reflections and anything else you'd like on a future agenda. So I'll open it up. Jensina.
Honestly, I think this has been one of the most productive meetings we've had. Having been on this committee from the beginning, it's felt like we've been slogging through mud, trying to make any progress and trying to have any measurement of if we're moving forward, what does success look like? Where's the milestones? Are we 50% of the way? We don't know because we don't know what 100% looks like. But this being able to actually really sink our teeth into something and collaborate together and hear everybody's perspectives, I think was one of the best experiences I've had so far as a committee member.
Thanks so much for that reflection. And I certainly hear that feedback. I know it's been challenging. So thank you for throwing down for this conversation and for all of your comments on the document and your live participation as well. Really, really appreciate you've always been pushing us, Jensina, to make sure that we are moving this work forward. And I appreciate that. So also thanks for sticking with us. Anyone else? Yeah, Colin.
Yeah, just it's funny to raise my hand and speak up about raising my hand and speaking up, which is something I've felt during our meetings today and in previous months, that like there's myself and a smaller subsection of this group are more verbal and more just like vocal about the topics than some other members of this committee. And so trying to hold on to the stepping up, stepping back, like stepping back when I don't need to say anything. I always can find something to say. But so I guess my reflection is I hope that as we continue to ramp up over the next year, that other members of this committee are able to speak up and participate, because I want to hear everyone's perspective.
Thanks for that reflection, Colin, and that self-awareness. I appreciate it. And I appreciate your participation, your active participation, and it's been great to see you at board meetings as well. So I do appreciate that, that level of engagement, and recognize that there are many styles of participating. And it is challenging in these meetings because we cannot use the chat feature, and that is because it makes it challenging for public meeting law and full transparency. And that limits participation basically to people who feel comfortable or are able to unmute and speak in the meeting. So we always try to create as many opportunities for people to provide written feedback between meetings via email, on drafts in the document. I saw a lot of great comments in the style guide draft. So that is definitely something that we appreciate and hold as just as valid and valuable and important for our process as anyone who speaks verbally in a meeting. And we welcome both types of participation. And if there is another way that you would like to participate, please let us know. We would do everything that we could to accommodate. And yes, we'll do what we can to make these meetings feel comfortable for folks to speak up, but also recognizing that not every personality finds that as easy as others. So thanks. Go ahead, Craig.
Thank you. No, I was just going to piggyback on some of the things you said, and Colin. I agree with everything you said. And a lot of times the reason I don't speak up is because I don't want to repeat what someone else said. Sometimes I'll have an idea and I want to say it, but someone will beat me to the punch. And I don't want to waste time just saying, anyway, I was going to, 2 or 3 times that happened today. And you answered one of the questions right now, Michelle. I was going to say, hey, can we enable the chat for the people who don't feel comfortable on camera? But you already answered my question. So anyway, thank you.
Yeah, thanks, Craig. I appreciate that. And that is, I think we want to hear from everyone. And I think that's a great reflection around, probably we don't need to repeat each other. And some of us might be quicker to the draw than others. So yeah, something we can keep working on. But I appreciate that awareness around use of time and not repeating points that have already been made. And also, I think that points to the fact that if you have a comment or a question and you are hesitating because you think that maybe you're the only one with that question or comment, the fact that more than one person is bringing up these things means that, if you have a question or comment, probably other folks do as well or would be interested in your thoughts. So yes, thank you. Anyone else? Other reflections or future topics? John.
Sorry, I guess I'm in the frequent hand raiser club today also. But I guess the question I had pertains to future topics and something you mentioned a minute ago, Michelle, about us this committee entering maybe a more active period of kind of co-creation and so forth. And I just wondered if some of the documents that you mentioned maybe coming soon, more kind of resource documents or talking points, whatever is in the pipeline of need for us to attend to next. Are those things that the committee will be involved with drafting, or will we be mostly kind of reacting to drafts coming from somewhere else, or how will that play out in the months ahead, do you think?
Great question. So everything on that list are things that the committee prioritized. So it's a list generated by you all, first of all. So you all came up with that list. Patty is going to, because it is less efficient to group draft from scratch and then send it to a strategic communications expert to edit. We're going to do it the other way around. So Patty has documents from the task force to look at, and then a lot of materials from our work and the work of the board and the other committees to look at. And so I think that the idea is that Patty will be drafting materials that you all requested and bringing those drafts to you all for feedback, kind of like the process that we just went through with the style guide. So we didn't have, Kim didn't come to the committee and say, we have this idea of a style guide. Here's a blank page. What would we like in it? And so I think we'll have a similar level of productive conversation and ability to give feedback on a draft.
Thank you.
Yeah, great question. Anyone else? All right, I am not seeing any other hands. So I think this brings us to public comment. Do we have any public comments today?
Yes, we do. We had 2 people sign up in advance. The first is Bobby Hall.
Great. Bobby, are you with us? Are you able to unmute? And then remind us how much are these timed, Isabel?
Yes, comments should be try to keep to 2 minutes. If you give me just a second, I can pull the timer up so we can all see it.
Yes. All right. Hang on just a second, Bobby. We're getting situated here. Bear with us. We're really grateful that you are with us today to share your thoughts. So 1 second.
I'm just switching my screen share. And there we go. So Bobby, whenever you're ready, can kick off.
Yes. My topic is really related to what you all were talking about today. I've worked for many, many years with the native tribes of Oregon. I've worked with all 9 of the federally recognized tribes, and many of them have very interesting health perspectives. And right now, you may know that the Trump administration is been really hard on them and is probably going to take away some of the many achieved goals. Gosh, over the last 50 years, there have been tremendous advances in dealing with tribes and in the tribal roles, how they participate in the greater communities. I started working with them in 1986. I was invited to come to Southern Oregon, where a burial had been disturbed. And the tribal member had gotten permission from the company that owned the land. It was right next to one of the larger state facilities. It was in Bandon, just north of Bandon. There's a wonderful park that many of you have probably been to a lot. And so we took a crew who excavated it. The tribe had gotten permission from the owner of the property. It was just right part of the actual park, just adjacent. And it was very successful. We worked with that tribe for another 12 years, very intensively, and then they were reinstated as a publicly accepted, nationally accepted group. Because before that time, about 10 or 15 years before, the tribes, many of the Oregon tribes had lost their federal status. They were given some money, of course, but $1,500 doesn't go that far per person, really, not even in those times. Anyway, so they got reinstated, and they've done wonderful work in their community. And we've done a lot more excavations. We've done a lot more other kinds of work too. We've worked with their folklore, their history, all of that sort of thing. And we're still excellent, good friends. The Coquel Indian tribe is a major leader. Well, since then, I've worked with tribes in other contexts too. I've worked with the Portland Area Indian Health Board. Now, health boards, this health board, the Portland Area Health Board, it covers 3 states. So it isn't just Portland area. So I've worked with them. I've been to Portland. I've been to the capital. I went with a group of about 10 Coquel Indian people when they had their hearing for their reinstatement. And they were reinstated about 12 years after we started working with them. They have contributed a heck of a lot to their community. But now, after having made all these health advances, and there have been many health advances over these last 40 to 50 years, it's been a wonderful time. Now, Mr. Trump, of course, is trying to take it away from them. He has rejected one of their major needs, which was reinstatement of getting access to fish and wildlife. And so I think in the past, and I followed the prior committee for 3 years that was working on universal health care for the state. And I know that there have been many advances, and now a treaty that had been worked out with the former president and his administration for them to get access to some of their fish and wildlife that had been taken from them has been put into question by Mr. Trump. So I think that in our past sessions of the 3 years of following with universal health care, it had been kind of left up to the tribal members whether they wanted to join with the universal health care plan that was going to be put in effect by the state or not. But I am fairly certain that under the current conditions, it's very possible they would be very happy to join. I've also worked with the Portland Area Indian Health Board on some health-related projects, such as
Bobby.
AIDS.
Yeah, I apologize. The time is
So
is
I would
over.
like to know whether you are planning to include them.
Thank you for those comments. So during public comment, we don't usually respond right away. And I will just say this is not the committee that's making those decisions around eligibility. So the eligibility committee, I could certainly follow up with the information for the committee that's working on the eligibility for the health plan. But I really appreciate you raising the current context and some of the history around the tribes in Oregon and federal recognition and broken treaties, certainly part of the context for the communications and engagement work that we're doing. So thanks for all that good work. Thanks for sharing it with us. I will follow up with you and get you the information.
Thank you. I would like
for the
that.
committee working on eligibility.
Yeah.
It's a great question.
Thank
All
you.
right. And Isabel, who was the second person?
The next person is Lou Sininger.
Okay. You ready? Hi. I again am pleased with what the committee is doing. The style guide is it's such a meticulous thing to do. I mean, it's what words to use and whatnot. So I appreciate you doing this. I think it'll help the whole governance board to use the same language. However, I did have I think people living in Oregon versus residency. I do hope that we stick with people living in Oregon because residency is something that the state wants to give people, but our program could be different than that. The same with the phrase non-US born. I mean, there's all kinds of other ways to get, you can marry and become recognized as a citizen and vote and all that. I would suggest that we just stay away from that whole idea and just stick with who's going to be in who's eligible to be in the program. Again, I'm going to press on you to, I think there should be a subcommittee to start identifying the groups that you want to reach out, that we want to reach out to, and start categorizing them and contacting them now to prepare for when you do come out. One reason would be to make them aware. There's many groups that are hardly aware. So if you could reach out to them, maybe they would then be watching you work the same as I am doing, right? So let's try to do that. Getting input now is important, and then revisiting when the whole plan is refined is very important. So thank you, and just remember, you are the first in the United States to ever approach this way. And so you're plowing new ground, and congratulations.
Thank you, Lou. And thank you, Bobby. Thank you both for taking the time to give us feedback at our meeting. We really appreciate that. And I take it to heart, and I know that other committee members do as well. I also see a hand up from a community member, and I just want to acknowledge, I see your hand, and staff, I think we require pre-registration. Do we have a process? I just want to make sure that we're sharing and not ignoring this hand that's up.
Yes, we do have.
We do.
I apologize. Go ahead, Isabel.
Oh, no, go ahead, Mimi.
Yeah, my sound is crummy. I'll let you go.
Yeah, so I was going to say, we do request for that public comment that people sign up for public comment at least 24 hours in advance. But technically, Michelle, it's your call in terms of how you would like to, maintain order in the meeting for public comment.
Okay, thank you. I'm curious, Craig, I see your hand is up. So just for everyone, we do have a place on the website, the Universal Health Plan Governance Board website, where you can sign up to give public comment ahead of time. That helps us plan enough time. In this meeting, I would like to be responsive and give 2 minutes to you, Cynthia, so we can hear from you. I know that sometimes these processes are not easy to navigate. And then I also want to get to your comment, Craig. Also, just so folks know, when we hear public comment, we do have a 2-minute timer. When the screen turns red, it means your time is up. We aren't super hard on ending right there, but if you could start wrapping up at that point, that would really help us end on time and respect everyone's time. And then we don't generally have the opportunity to respond right away. We take your comments, we reflect on them, and if any follow-up is needed, we will commit to trying to do that as well. So just so folks know. But Craig, did you have a quick comment before we get to Cynthia?
I apologize. Hey, all I wanted to know is a housekeeping question. Last month when I had my jury duty, I didn't know who to contact. I know the state people switched. We had new people, representatives. Could someone maybe send us all an email just so we'll have some contacts? I sent out 3 emails that last month, and Michelle, I'm sorry I bothered you. I didn't know who to contact to say I couldn't be at the meeting. I just wonder if we could get updated contacts from the state or whatever staff people. Thank you.
Okay, perfect. We can certainly do that. Thank you, Craig. All right, Cynthia, if you were raising your hand to give public comment, we do have the 2-minute timer for you. And after that, we will adjourn the meeting. So are you able to unmute?
Can you hear me now? Great. And thank you for making the call that you did, because I wanted to comment on disability. And this meeting is an accommodation for my disability, which is a multi-system disease. And I cannot predict, when I can't, even listen this long. So, and I want to thank this committee quickly for being down in the weeds on the work that you're doing. It's really important. And I think what I would like to say is I would like to see a broader definition of disability written. People on the board, the governance board, or your committee may well understand disability and accommodations, but the general public doesn't always. And in terms of Americans with Disability Act, and I think it would be good to have examples like multi-system diseases in there, because people with my disease, ME/CFS, are often bedridden or housebound. But in terms of medical, also access and accommodation. So disability can include, a cancer patient going through treatment who may need different accommodations to access their medical care, someone with 2 broken legs. But multi-system diseases, I think you need to look at it differently, and also much broader, I would like to see. And I think maybe that will help then bring up the eligibility, issues, as well as you guys obviously, will be raising awareness. So thank you. I don't want to hold you all up, but yeah, I think we need a much broader and more current, updated definition of disability. I'm sorry, Amy's not here today. I know but I think you all may get it, but the general public will need to as well. And that will be helpful to Oregonians around the state. Thank you very much.
That was such perfect timing. Thank you so much, Cynthia, for your feedback. I really appreciate that and your lived experience. Thanks for sharing that, and for being with us today, for spending your time and energy when you have it, on, participating with us. Really means a lot. So thank you. All right. This was a great meeting. Really appreciate all of you members of the public for being with us, members of the committee for all of your thoughtful participation, staff. We couldn't do this without you. Thank you for all the prep work and all the support. We will see you all in July. And if you need anything between now and then, real quick, can we get, Isabel, do you think we could get an email out to every committee member with the current staff names and roles, as well as the notes, so that folks know who they're reaching out to if they need to let us know that they have jury duty, for example, theoretically, if that were to happen?
Yes, absolutely.
Great. Okay. Thanks, all. Take good care. See you next month.